Let's go to a topic called as peak heart rate. So how do we calculate the maximum achievable heart rate in patients undergoing treadmill testing or exercise testing? So maximum achievable heart rate is unique for each patient. The most familiar equation, which you all know, has been reading from, which has been knowing from long time, is maximum heart rate of any person is equal to 220 minus age of that patient. So suppose if you are 30-year-old, the maximum heart rate achievable or by you should be 220 minus age, that is 30, that is 190. So although easy to apply and calculate, there is considerable variability with this equation, especially in patients with coronary artery disease who are taking beta blockers. So often we come across patients who are on beta blockers or heart rate controlling medications. So for that patient, you cannot apply this formula. And for them, there is separate formula which is given. If any patient is on beta blockers, is equal to 164 minus 0.7 into age. And for other thing, men and women, the actual formula is 208 minus 0.7 into age, 208, and 206 minus 0.88 into age for the woman. So coronary artery disease with beta blockers, 164 minus 0.7 into age. Coming to chronotropic incompetence. Chronotropic incompetence is defined as the inability of the heart to increase its rate to meet the demand placed on it. It is termed as chronotropic incompetence. That is, inability of the heart to reach the maximum heart rate which it should achieve is called as that. It is considered as an independent predictor of cardiac or all-cause mortality. So an inadequate study is defined by failure to achieve a predefined goal. That is, any patient should achieve at least 85% of his maximum predicted heart rate. If a patient without known coronary artery disease has an inadequate study, the term non-diagnostic study is often applied. In the presence of any other diagnostic endpoints, so suppose patient has not reached this maximum heart rate, but it has reached a 2-meter or greater ST segment depression, exercise-induced hypotension, or exercise-induced anginal chest pain, then the heart rate adequacy question becomes irrelevant in that case. And because the endpoint has already achieved, you can consider it as diagnosed.